This first session, your first class in the medical college, I will take up the role of physician in healthcare system. You know who is physician? Physician actually is a medical practitioner. The medical practitioner who is qualified to practice medicine. They are highly trained personnel to take care of the human being. So physicians are not only doctor or medical practitioner, they have got to play many roles in the society. They are natural leader. So by acquiring the degree, you have become leader of many aspects in the environment. I will discuss this, how you will become leader. So by now you know medical professionals, a group of individuals qualified to practice medicine. So physician is a team leader. There are many other persons to help you to discharge your duties, services, just like nurses, nursing officers, other paramedical staffs, like laboratory technicians, OT technicians, then your some medical social worker, and also physiotherapist. All many branches of this medical science has got many support staff. So we work in OPD, our nursing official is here. In office, Prashant is there. Okay, so we take the help. So they become a compositions of our healthcare allied professionals. So they work that still deal with healthcare but are not distinct from medicine. All right, they work under our supervision. So they are allied healthcare professionals. So physician, as I said, they are. I will come down. Can you see now? Is it visible? They are natural leaders both in the healthcare environment and the community. To become community leader is not a matter of joke. All right? So doctors act as a voice for the patients, communicating their concerns, wishes, preference to other healthcare professionals. So we are advocates for our patients. All right? Doctors play a pivotal role in the society as they serve as guardians of health and well-being. In addition to providing medical care, doctors play a vital role in patient education. We do education program for the patients, awareness program, health awareness program. Okay, there are many days, say as per World Diabetes Day is on 14th November. We will be organizing an awareness program for the diabetic patients and also for the people at large. Doctors also serve as advocates for their patients, that I have told already. Furthermore, doctors are healers of emotional and psychological distress. There's certain untoward events happen to the family member of a person. So the way you talk, the way you communicate, okay, that will give at least some hope for the patient party. They will not be aggressive. The way you talk, they will explain what happened to the patient. Okay, that's more important. You should have some courage, some your time to devote to communicate with the patient party. So they are the healers of emotional and psychological distress. You understand now? Okay. The role of doctors in society is multifaceted. So many roles are there and indispensable. Nobody can give so much service to the society. Their commitment to the health of the community at large is invaluable. You cannot measure with money our role in the society. That's why doctors are regarded most. Okay, it is still there. Though it has deteriorated because of some changes in the environmental factors. Many factors are there. All right. And you know that you have also learned doctors are second to God. We are not God, but for the patient, you are God. For the time being, when the patient is in a critical situation or patient party is in very anxiety state for the recovery of the patient's healthcare. Okay, problem. So I told you that there are two objectives. Learners should know 5 roles of Indian medical graduates. So IMG, Indian Medical Graduates, new curriculum, CBME, I told you, competence-based medical education. It has come into 2017 as suggested by National Medical Council currently. You should know the roles of, what are the role of you will have in the society. Number 2, learners should know some other roles of physician in the healthcare system correctly. So I have already narrated. I will discuss, elaborate all these other roles. Okay, apart from your original role as a physician. Indian medical graduates, as suggested by NMC, they are clinician. MBBS is clinician. You can practice. What is the full name, full form of MBBS? Yes, Bachelor of Medicine and Bachelor of Surgery. After you pass out, finish your internship, the certificate will be given. You are competent to practice medicine and surgery. Also, they will include gynecology. All right. Leader and member of the healthcare system. Good communicator, lifelong learner. I told you in my beginning introduction to you that a doctor learns till he dies. You have to acquire many degrees, many fellowships, may undergo workshop training. Okay, every day you learn from anybody. I learned from anybody, I told you, in my life and professional. Above all, you have to keep up your dignity as a professional. There are some professional ethics you have to follow. All right. Other roles of physicians, they are researchers. You do some research, some find out. I told you also you can make some papers while you are in this departmental posting will be there for you. During MBBS student also you can do it. Internship also you can do it, and afterwards also you can do this. So researchers, teaching. So every day and now you can teach your own classmates. While I was student, few of my colleagues, even in post graduation also, what they say that you teach us. You teach us means I have to read, they also have to read. So it's a mutual understanding. Classmates also become teachers. Okay, you will be given in the seminars, there will be seminars. In seminar you have to present, we will be also present. So at that time you are teacher, our teacher. All right. Manager, when you pass out, you are somewhere, maybe in private, maybe in government setup. You are team leader, I told you. So you have to look after many things, not only this clinical part, how the hospital has to develop, how what person's deficiency is there, sister deficiency or some other people's deficiency is there. You have to find it out. Whether the environmental problem, internal pollution is there or not, your hospital is not clean enough. You should look after all the things. So you become the manager of the institute. All right, and also policy makers. So how to develop this institute? So you have become policy makers. But unfortunately, our profession is not given that much regards as of now to become a policy makers. Okay, policy makers are some non-medical persons. So you see that researchers, I told you, how much research they made. The doctors of ancient days, Scottish uh, James Lind, a Scottish doctor, you know the scurvy. Scurvy is because of vitamin C deficiency. All right. So those days there was no air. Your journey was not that very feasible. They used to journey through the seas, long times in the sea. So food was not your fresh. Vitamin C was deficient in the people, and they suffer from this scurvy, and many people die because of scurvy. So Dr. James Lin found out that uh, scurvy is because of vitamin C deficiency, and he also advocated where the vitamin C is found. It is found in your citrus fruit, and it is very high concentration in Indian gooseberry. Okay, so Edward Jenner, English doctor, the pioneer smallpox vaccination, the father of immunology. What he have researched? Research says those days cows used to have the smallpox, cowpox. So a milkmaid people, they have the source in their hands. So he inoculated this source part of a milkmaid to a child of 8 years. Those days, people having the smallpox, cowpox, they are immune to smallpox. Right. This is the way how the smallpox vaccination came. So that's why he is regarded as father of immunology. You know this oral polio vaccines. Okay, 7 vaccines, oral polio. Previously it was shock polio. You will be learning immunizations. This it was your intravascular polio vaccine. It was available first. Then the oral polio became giving injection is difficult to a child. No, so the oral polio came. And Louis Pasteur is the father of microbiology. He has found out the organisms, these bacteria, parasites. All right. So they are all the medical researchers. Medical. So you may not go at that point, but you may find out some your research and can discuss in this conference, maybe in the state level, national level, may also be international level. This is the way it comes out, the research. Once you find out, that will be studied up, followed up in many countries, and if your thesis part or your objectives part is okay, then that will be accepted and will be awarded award. You will be awarded award. May also get Nobel Prize. Okay, we should think high. You should be optimistic, not pessimistic. Okay, I'm not telling that everybody of you should think for the Nobel Prize, but you think for some sort of research you will do. All right. So, medical research, the leader part. I told you this natural leader. This is a picture of Professor Shashank Joshi, Padma Shri. He is your professor of endocrinology, practicing in Mumbai, of international repute. Made many research works, many hypotheses, gives many lectures. He is mentor of mine and also my friend. This is your picture of Harshavardhan, Dr. Harshavardhan. Dr. Harshavardhan was our ex-health minister of India. During COVID period, he was the health minister of India. He was an ENT surgeon, prominent ENT surgeon. He was director of All India Institute of Medical Sciences, Delhi. All right. So definitely, ex-health minister means he is a leader. Apart from your profession, his profession, dedicated profession, ENT surgeon. This is a picture of Dr. Jitendra Singh. He is Minister of State, Independent Charge. He is a renowned diabetologist from Jammu. He came here many times, but he is now minister, second term minister. So doctors also can become leader in their own profession, leader in the community, leader of the nations. All right. So let us go to extract from the Graduate Medical Education regulated 2017. The undergraduate medical education program is designed with a goal to create an Indian medical graduate, possessing requisite knowledge, skills, attitudes, values, and responsiveness so that he or she may function appropriately and effectively. What is important? Appropriately and effectively as a doctor of first contact of the community while being globally relevant. That means I told you that you are the first person to contact the community. People contact you, and that is also of international standard, relevant globally. Okay, so you should be proud. Our course was not like that. Our course is little bit different. All right. So role of clinicians. By now you know the preventive role. Prevention is better than cure. And promotive role. Promotive role. How you promote? How you promote the good environment? How you promote the good treatment for the patients? A good thought for the patients. A good school of thought. Okay, I believe in school of thought. Somebody else may believe in some other school of thought. This drug is better for this patient. Somebody will say that drug is better for the patients. But you should promote a good part of your treatment to the patients and curative part, palliative part. Palliative part means end of life your services to the patient. Palliative means you cannot do any definitive treatment for the patient. Say for example cancer. Okay, then HIV patients, very elderly patients. Okay, there is nothing much to do to cure the disease process, but you have to give some service to the patient so that life should go on. Okay, life should persist. That is called palliative treatment. Most of the cancer patients, they require palliative treatment. Is it alright? And holistic care with compassion. You should be sympathetic to all your patients. You should be empathetic also. What is empathy? What is the difference between sympathy and empathy? Sympathy means you feel for the patient, and empathy means you put your shoes in the shoe of the patient. You feel how much pain patient is suffering or patient party is suffering. That is empathy. Okay, so you have to do both sympathy and empathy. All right. So this is called holistic care with patients. So primitive role, immunization. By now you know the immunizations. Immunization, you know all immunization. Immunization class will be there. Our patient will take the immunization class. RCS program, reproductive and child health program, that also will be taken up by some of our colleagues regarding your Government of India programs, NCNC, antenatal clinic checkup, postnatal after delivery checkup, and family planning. That is relevant and for you in the community practice, especially in your community medicine. Okay, contraceptive devices, vector control. That is important. You know this malaria, dengue, malaria, everything is coming from some vectors, mosquitoes. So that has to be controlled, vector control. Vector control that will be dealt by community medicine and nutrition. Nutrition is a very vital part. What do you think? You should not take rice much. Diabetic patient has got a different type of the nutrition, different type of less carbohydrate. They should take more than 50% of the calories should not come from the carbohydrate. Protein should give near about 10 to 15%, maybe 20% if kidney function is okay. And fat calorie percentage should not be more than 30%. So nutrition, balanced diet should be taken by everybody, whether you patient or not patient. Okay, every human being. And some nutrition is disease specific. Somebody is suffering from kidney problem. Diet will be nutrition, diet will be different from plain diabetic patients. Okay, heart patients, CBD patients, cardiovascular disease patients, diet will be little bit different. Okay, is it clear? So this is how we feel the nutrition. What is the status of the nutrition here? How do you divide the patients as well nourished, malnourished, or obesity? When your body weight is more than 20% of the ideal body weight, your level will be obese. Alright, what is ideal body weight? It is your height in centimeter minus weight in kg. Height in centimeter minus 100. Height is, suppose your height is 170 centimeter and your minus 100. So this is 70 now. So if your weight is more than 20% of this 70 kg, this is 84 and above, you will be labeled as obese. Obesity itself has got many inborn diseases to have, like your diabetes mellitus, 20% more common in the obese people, hypertension, cardiovascular diseases, gallstones, and arthritis. And there are many also. Alright, so this is obesity. So this is the ideal body weight is 70 kg, no? 170 minus 100. So if your body weight is less than 20% of your ideal body weight, you will be labeled as malnourished. So 70 minus 14 will be how much? 56. No, 56 is a low body weight for a person of 170 centimeter. He will be labeled as malnourished or undernourished. So undernourished also has got many other diseases to contract. Okay, they may even have a tuberculosis, diarrhea, dysentery, even diabetes. Because of your undernourishment, there are maybe history of pain in your childhood. This will develop some viral infections. This may destroy your beta cells to secrete insulin. All right, okay. So undernourished also is not good. So according to this body weight, then BMI is there, that will be taken up by you. What is the normal BMI? More than 23 to 25 is your overweight in our country. More than 25 is obese. Foreign countries more than 30 BMI. BMI is body weight in kg by your height in meter square. That is the formula of the BMI. If your BMI is less than 17, it will be labeled as undernourished. So according to this nutritional status of your person, the diet will be advised, nutrition will be advised. Alright, so naturally undernourished will require more nutrition, more food than the obese persons. You follow now? Alright, so remember two, ideal body weight and BMI and nutrition. From where you will get carbohydrate, protein and fat. 1 gram of carbohydrate how much give calorie? It is 4 kilocalorie, fat gives 9 kilocalorie, protein also give 4 kilocalorie. So if you divide this, you know this, you divide this calorie amongst the foodstuffs. Is it alright? Then health education. Health education, you know this, we are doing this, you know health education. Alright, there are different modes of giving health educations and that will be taught in your community medicine. Okay. So promotive role, this Trans and Clifford 1994, that's the modules. How will give this, promote this health educations or health services. So health promotion is the process of enabling people to increase control over and to improve their health. It moves beyond a focus of individual behavior towards a wide range of social and environmental interventions. Some models are there, 5 models, 6 models, 9 models, that will be taught in your community medicine. How will you promote this healthcare in the social and environmental interventions. So health promotion is health education, and unless you make some policy, you cannot do this. Do think that I will give education in this system by giving lectures or by showing some your folk dance in drama type, or by showing some your pamphlets, papers, printed papers. You can, this is will come under health policy for public. Is it clear? So curative role, diagnosis, how to make a clinician to give a diagnosis to the patient. History, you have to take, how to take the diagnosis from history. When a patient steps in your chamber or clinic, by looking this, you can say that the patient might be having this. Okay, those days, earlier days. I'll take up one class on history of medical medicine in India, or it's in India and up now. So, Dr. Bidhan Chandra Rai, have you heard his name? Bidhan Chandra Rai was the Chief Minister of West Bengal. Those days, so many investigation facilities are not available. Nowadays, when a patient comes, we do some investigation as required for the patients, not all the investigations, as per the requirement of the patients. But, I'll tell you one story. When I passed out MBBS, just few days after, one call was there from one of my senior colleagues' father. That colleague is in Indian Army service, away from the state. So his father was a professor upon college there, General College. So he called me. So I went to blood pressure and stethoscope. He told me, without examining me, you tell me what is I am suffering from. I'll give you the history. So it was not possible for me at that time of period to give a diagnosis. Then he said, okay, you examine. All right. So by history taking or by the appearance of the patient, you can have some first-hand diagnosis. It may not be correct all the time, but you should develop this. We should not be, you depend on machine. Okay, modern science, modern medical science, they write down many things and we are dependent on machines. And clinical medicine is put backwards. But you must develop your clinical skill. Clinical skill is more than the machine. Machine may mistake, but your clinical skill may not be all right all the time. All these tests will help you to come to a diagnosis. They will only help you. You follow? Okay. We do not, I used to tell my students, they do not treat the test. We treat the person. You follow the meaning? They do not treat the test. The thing, test report is this, but it is not coming to you. You cannot anticipate the patient is having this. Then you may differ. So you treat. You forget this test. Don't give any importance. If you are in doubt, you consult the other colleague or senior. You follow? So by taking history, then examination, that part will be your clinical examinations, then investigation. Investigation will only help you. Don't write first investigations. All right? That is my motto. Could I explain? You understood now? All right. Now, treatment part also, we must think first for your non-pharmacological. Suppose a patient you see this blood pressure is high. Okay, blood pressure is high. So, what you will advise to the patient? Take less salt. Salt should be restricted. Adequate sleep, and some sort of your tension is there. Everybody is tension nowadays. Okay, the stress and strain should be avoided as far as practicable. Okay, this is part of non-pharmaceuticals. Yoga and all also will come in non-pharmaceutical type. All right. Then you have to write drugs for the treatment of hypertension, and if the patient has got some other surgical problem, that patient has to refer to surgeons to get the remedy. All right. So palliative care, I told you palliative care is the treatment of the discomfort, symptoms and stress of serious illness like cancer, HIV, chronic respiratory and cardiovascular disease, etc. It provides relief from distressing symptoms including pain, especially pain for the cancers. You have to write down this some sort of your morphine, pethidine. All right, this type of drugs, shortness of breath, fatigue, constipation, nausea, and loss of appetite. These are all symptomatic treatment. All right, holistic care is a term derived from Greek word holes. Holes means some sort of you're digging something, no? But here you see that meaning that whole, W hole, everything. Holistic views the following aspect of a person's life as integrated whole. This is physical, Okay, this is your definition of health actually nowadays. Physical health, we see this. Intellectual, socio-cultural, that is more important. Psychological and spiritual aspects. So, the health as a whole, all system. We forget this spiritual aspects, psychological aspects, socio-culture. We should not forget this. Not mere absence of disease. It does not mean that patient is healthy. Alright, he should be psychologically also fit, and spiritual aspects also should be maintained, and apart from his physical health. These 5 aspects cannot be separated or isolated. Anything that affects one aspect of person's life also affects the other aspect. Examples of the movies, have you seen Bulbulia or their Diyar Jindagi? Movie was there, Bulbulia and Diyar Jindagi. So this, when your aspect is lost, that life will be lost. Okay, even though we are physically fit. Alright. So, coming to the leader, member of the healthcare system, and physicians should be able to collect health data appropriately. You have given some investigations for the patients. You see the report. So, you see that, analyze this data appropriately, synthesize the health data appropriately, and communicate health data appropriately. You've seen, you come to conclusions, you tell to the patient party, then you give treatment. Alright. So, that is your leader and member of your healthcare system. You should do this. A communicator with patients, families, colleagues, and communities. So many people you have to communicate, not only with the patients. It is a manner of communications which is important as compared to information. Effective patient-physician communication equivalent to drug. Many times patient will say, sir, I have come to you. I have my 50% disease is over now. Cured. Because of your communications, your acceptance to the patients, your behavior to the patient and patient party, how you have respected them. Okay, how you dealt them. So, good communication is equivalent to drugs. The physician who can communicate bad news in a direct and compassionate way, I have given you examples, help the patient cope, strengthen the therapeutic relationship, endures and further extends the healing process. You understand every word of this line? So that is very important. You build up gradually. All of a sudden you cannot do that. Alright. So, to become a good communicator, some competent 5 key communication skills you must have. Listening effectively. Many times in government setup or busy OPD schedules, we write the drugs without listening to them effectively. Without completion of their elements, we may write some drugs, some of my colleagues may write some drugs. So, you have to listen them effectively. Eliciting information using effective questioning and skills. If you are in suspicion that what the patient is describing, you should ask some questions. When did this pain start? What is the pain? What is the associated with vomiting? Okay, is it relieved by vomiting? Gallbladder stone is very common in our state. Patient will come with a pain in the abdomen, vomiting. After vomiting, the pain will relieve. So, from this history, effective listening and your effective questionings, you can come to the diagnosis that probably the patient is suffering from gallstones, acute cholecystitis, cholelithiasis. Understand? Alright, providing information using effective explanatory skills. So, if you give the information that I feel that probably some stones may be there because gallstone is very common here in our state. Patient may be suffering from gallstones or gastric ulcers or peptic ulcer diseases is also differential diagnosis of gallstones. Okay, so you have to do some sort of investigation, ultrasonography you have to do. Okay, so that's why you have to explain the skills, counseling and educating the patients, and making informed decisions. So, by the way, you counsel the patient, they give educations. Gallstones may be there, making informed decisions based on patient's information and preference. He may agree, he may not agree, but you say that you get this done, not right now, may do it after a few days. If pain is relieved, it's not relieved, to do it urgently. All right, all the time patient may not be prepared to get an ultrasonography done. So lifelong learner, I told you, I still keep on learning. Okay, so adding more degrees and courses, undergoing training and workshops, attending CME and conferences, research papers, writing and leading. Presently, I told you medicine MBBS students also can do some sort of project work. Continuous upgradation of knowledge with books, internet and other sources. So you have to be lifelong learner. One student told that she wants to remain very busy. You are not, you told. So she has to remain very busy with this type of things, doing some sort of research. All right. The doctors are always busy. There is precious time. Any doctor, lots of work to do. All right. So continuous upgradation of knowledge with books, internet, and sources. Professional, you must be committed to excellence. Professional peak, I should be in the excellent stage of my profession, in the peak of my profession. Okay, you should get the reputations. All right. Ethical, you have to be ethical. You cannot do everything to the patients. Anything in the society, you have to be ethical. You are bounded by ethical code defined by NMC and State Medical Council, and responsive. Treat the patient in empathetic way. I told you what is empathy. You should feel the pain of the patient party, that you are the patient or patient party. If this happens to you, what will do? Okay, this is empathetic. Accountable to patients, community, profession, and society. So you are accountable also for medical negligence. Medical negligence, willfully do some sort of negligence, it is medical negligence. But you do not know if some untoward incident happen, this is not medical negligence. Not knowing the things is not your some sort of punishment should be there. Okay, everybody cannot know everything. Okay, willfully you should not do. Some rule of law should be there, and there the Consumer Protection Act is there, and RTI. RTI is your suppose the patient is dead in the hospital, patient party may ask for what treatment was given, who has seen the who has seen this patient, doctors, sisters. So they can ask for your information from the institute. And citizens charter, you have seen that this block 2 lecture 1, it is depicted where you will go. This is your citizen charter. Our hospital also has got GB hospital, my own hospital is started up this citizen charter. It has to be there depicted where you will go. What is the medical surgical unit? What is the medicine unit? What is the super specialty block? What is the emergency? That is citizen charter should be there. So as a team leader of the institute, you should know all this. All right. The role of physicians, researchers, and scientists. I told you that science changes each week, and it will change in fundamental ways during our careers. It is changed the fundamental ways, MBBS careers. So the CBME, little bit different from our course. We must continuously read and evaluate the literature, discuss with the colleagues. That's why I told you, you have to do some sort of discussions. You cannot learn medicine by your own, alone, and formulate opinions that impact our practice. The physician scientist has a contribution that is unique. See that, suppose you are pursuing your medicine, so you become a research, some sort of research you have done, you become very popular, your research is accepted. So there is difference between a medical doctor becoming scientist and a non-medical person becoming scientist, because they do not have the scientists who do not have received this medical training, they are little bit different. The contribution of a doctor will be given more in the society. The doctor become scientist. You follow? Indian medical scientist. I'll show you the Hargobind Khurana, Nobel Prize for Physiology in Medicine in 1968. Then Subbarao developed a cancer treatment called methotrexate and diethylcarbamazine, the only known treatment for filariasis or your elephantiasis. Oshima Chatterjee contributed to the development of powerful anti-malarial and anti-epileptic drugs. Somaya Swaminathan, she is a pediatrician, Director General of ICMR. She has done lots of work in tuberculosis. And Poonam Khatpal Singh, Regional Director for your Southeast Asia, which WHO Center. You see the C.V. Raman is a physicist. You have heard the C.V. name of the C.V. Raman. He was a known physicist, received Nobel Prize. Okay, the spectroscopy, you will be going through this biochemistry lab, no? Spectroscopy is there. So the spectroscopy, he has invented this light scattering. Okay, spectroscopy, you have to find out what is the level of your bilirubin, blood sugar. Okay, spectroscope was there. But nowadays it is done in the autoanalyzers. So he has given this Nobel Prize. This is Khurana, Oshima Chatterjee, Dr. Swaminathan, and Poonam Khatpal Singh, and is your Subbarao. So these are your scientists. Teaching is your communications, educations, and counseling. You can teach these ways to the society. Our class also is a part of teaching through these communications. Okay. So role of physician is a manager. You know this manager is expected to be responsible for selection of the other staff members. But we usually do not have. I cannot ask that you should put this person here to give services. Okay, if I tell also that will not be, they will not listen to us because of so many things. So anyway, but you have got the right to tell the selection of other staff members, providing him or her with the orientation to the role. If you are selected that patient, that person to give services, so he is to give you to give training to her, him or her to orient her role. Assigning one after the training, you assign him or her the work, evaluating the performance, evaluate it, and later on, if you require more training, you provide them. So this way you become manager of an institute. Okay, right? So policymaker. See the policymaker, researcher and policymaker. The physician's medical expertise, experience at the bedside, status in the society can provide invaluable perspective and influence in forming the policy process. So you've got, our profession has got a different dignities, noble professions. It is supposed to be the best professions. People may think otherwise, people may think that civil services are the best professions, but it is not so. It is not so. In our days, only your front benchers, they used to go for medicine or engineering. Other people options are different. Alright, so because of our inherited status of this medical profession in the society, whenever doctor says something, that is respected by many people in the society. You have got a different respect in the society from doctor's mouth. Okay, this thing will come out, that means it is correct. Alright. So this way it becomes a policy process. Doctor-patient relationship offers unique insight into the lives and needs of the vast cross-section of the public. This is the way it becomes very popular in the society. So physician's role in a changing healthcare system is changing. Every day it is changing. So you've got some more roles to play to decide which diagnostic test to order. That I told you. You cannot write, it's a patient coming with you think that it is malaria or dengue. You will differentiate between two. You do specific test for this. You cannot write other tests. Okay? So you have to think what test you have to do, which is whether or not patient should be hospitalized. You have to think whether to patient admit or not. There is definite guideline. You cannot admit all the patients. Alright. What therapies to employ? After that, what medicine you give? I told you, there will be two schools of thought. Whatever you prefer, evidence-based. Medical science is evidence-based. So you give the treatment to the patient, and which drug to prescribe, whether therapy is effective. After that, you see that whether she is responding to treatment. Responding to, see, I will give you an example. Suppose a patient with ascites comes to your OPD, or patient, you admitted the patient because of you use ascites, and you feeling your some sort of breathlessness, symptoms of breathlessness is there, neck pain is engaged, pedal edema is there. Okay, so you admit the patient. So first treatment, suppose you think that it is a patient of decompensated stage of cirrhosis of the liver. All right, by seeing this engaged veins in the anterior abdominal wall, you know this caput medicine and all, study medicine. So you started giving antidiuretics. Antidiuretics, gradually step up the dose and may go to the maximum dose, give for 7 to 10 days. You see that every day you observe, or every other day you observe whether the patient is responding or not. How do you know they're responding? The ascites will gradually come down, edema fluid will gradually come down, and his weight also will come down gradually. But it is not responding. The drugs are not responding to the patient as you desire for optimal period, optimum dose. Then you think that the drug is not effective for the patient. You have to go some other measures. All right. The patient may require definitive treatment is liver transplantations for the patient. Tips is there in between. You will be learning what is tips. All right. Then you have to decide whether the patient, not that patient, whether the patient can be discharged. The patient you have admitted. All right, there will be some criteria to fulfill. You be satisfied. Okay, the patient is dischargeable. You can plan to discharge and discharge the patient. All right, so this is the role of the physician and this changing healthcare system. So before I end this, I wish you all the happy Deepavali 2024. You know what is temple? Tripura Santiniketan Temple. All right. Okay. Thank you.